Okay, so I think at 10:02 with about 92 participants, which is very encouraging to see, very exciting that we can begin this morning. So good morning to everyone and welcome to the launch of the Jamaica Stroke Alliance. We certainly hope you are all well, very unprecedented and often precarious times. We hope wherever you're joining us from this morning that you are well in body, well in mind, and we welcome you to this very, very important launch of an organization formed to help save lives and improve the quality of living for those in Jamaica who have either suffered a stroke or have a family member or someone close to them who has. I am not here this morning to go into stats or to tell you about strokes. I'm here just to guide the proceedings. My name is Simone Clark Cooper and I'm your MC for this morning's event. There are many here this morning though who can provide that information to you, and so we invite you to stick around for the remainder of this launch to get what is and ultimately could be life-saving information. This morning we want to acknowledge our speakers and our panelists. We have the Minister of State in the Ministry of Health and Wellness, the Honorable Juliet Cuthbert Flynn, the founder of the Jamaica Stroke Alliance, an amazing woman, Mrs. Hilary Webby, Chairman of the Grace Kennedy Foundation, Dr. Fred Kennedy is here with us. We hope to be joined soon by the Honorable Earl Jarrett, CEO and Chairman of the Jamaica National Group. We welcome Sarah Belson, International Development Manager of the World Stroke Organization, Doctors Kimikawa Morgan Channer and Amza Ali, who are here with us, social policy researcher and consultant and advisor to the Jamaica Stroke Alliance, Mrs. Bridget Levy, Jazeel Martin, and Father Richard Holong will be participating this morning as well, albeit by video. Each of these individuals will be sharing with us either here on the Zoom meeting or have recorded something that will touch your hearts. I promise you, if you stick around with us, you will find out what that is. We also welcome the GK family, anybody else joining us, particularly the members of the Grace Kennedy Foundation who have helped to put this event together, Executive Director Caroline Mahfood and her support team, and anyone else joining us from wherever you are in Jamaica or across the world. This project has been receiving full support from Grace Kennedy through its foundation, as well as the Jamaica National Group, and so we thank them for that. For those of you who know, Grace Kennedy is a praying company, a caring company, they both are, and so we start things off this morning with a prayer. Father Richard Holong from Missionaries of the Poor has sent that for us, and so we treat you to that now.
Good day, brothers and sisters. We offer prayers to the Lord that on this day, when the Jamaica Stroke Alliance Society is initiated by Hilary Webby, that you bless it, make it useful, productive, that it will bring forth life and relief and happiness to many people who suffer from a stroke and are not able to take care of themselves. Watch over them, Lord, and guide them, provide for them, that they may enjoy a longer life, a life of relief from this sickness, this problem. We ask you, Lord, that Hilary be blessed and all those who work with her, and that many of our people will come to know the Lord and his kindness and his goodness to those who are not able to receive help. We ask that you bless us and make us a nation, or little Jamaica, that is full of health, which is a sign of the love of God, and also that you watch over those who are working towards the betterment of the health of others. We pray, Lord, that this disease, heart disease, which is so prevalent, throughout the world and also in Jamaica, that you will guard and protect us, watch over us and take care of us, and bring forth your loving compassion to those who are the poorest of people and are not able to receive such help. God bless you.
All right. Thank you very much, Father Holong, for those words. We receive and we claim every blessing. Now to get into our event, I mentioned to you earlier that Grace Kennedy is one of the companies that has thrown its weight behind this event. We now invite Chairman of the Grace Kennedy Foundation, Dr. Fred Kennedy, to address us. Dr. Kennedy is an educator. He's dedicated to the development and improvement of schooling for children of all ages, both in Canada, where he currently resides, and in Jamaica. He has served with great pride as chair of the foundation since 2017 when he was appointed, and we welcome him now to give his remarks for today's event. Dr. Kennedy.
I was just on, is my voice going through yet?
Yes, we can hear you.
Okay, wonderful. Good morning. And thank you, Simone Clark Cooper, and greetings to you all on this momentous occasion of the official launch of the Jamaica Stroke Alliance. 2 years ago, when Mr. Simon Roberts, he was then Chief Information Officer for Grace Kennedy and Company Limited, approached the foundation with the idea of forming a Jamaica Stroke Alliance. Our board of directors openly accepted his invitation to assist with the launch of this new initiative. So here we are today. The concept of a National Stroke Foundation had first been advanced by former Senior Product Development Officer, Mrs. Hilary Webby, who had worked for Grace Kennedy for over 30 years before suffering a stroke herself in 2015. The incredible bravery and faith that you have shown through this all, Hilary, is an inspiration to us all. As an established nonprofit corporation, we were in a position to assist their board with the formulation of a plan, potential sources of funding, and applications for a charitable organizational status. Their mission of awareness, education, and advocacy of stroke prevention was fully aligned to one of our own 3 strategic focuses, that is, the promotion of healthy lifestyles, in keeping also with one of our parent company's key interests. As a corporate foundation, our role is to support Grace Kennedy as a corporate citizen. Increasingly, corporate citizenship is accepted, and I quote, as a crucial strategic business practice, vital not only to sustainable progress of our economy and communities, but also to business success. Grace Kennedy's corporate policy states that the company has a long-standing practice of maintaining the highest standards of corporate social responsibility in its business activities and dealings. It commits to being a good corporate citizen, mindful of its responsibilities to giving back to Jamaica. We Care, which is the mantra of Grace Kennedy, has always been founded on the belief that the creation of wealth and the improvement of socioeconomic conditions are not mutually exclusive. In fact, they complement each other and have been an integral part of the company's culture since its inception in 1922. The company works through 2 foundations, Grace and Staff and the Grace Kennedy Foundation, to serve its communities and to make contributions in the areas of education, health, community outreach, and the environment. We share with the Alliance the belief that stroke prevention and advocacy address an urgent social need in Jamaica to help alleviate one of the most serious health crises that we face. Dr. Ernest Madu and Paul Edwards, who are consultant cardiologists at the Heart Institute of the Caribbean, It stated earlier this month in the Jamaican Observer that stroke is a leading cause of premature death and long-term disability in Jamaica. And the economic costs related to lost income, disability, and the economic and social disruption, treatment, and post-stroke care are substantial. The Ministry of Health, in the National Strategy of Action Plan on the Prevention and Control of Non-Communicable Diseases in Jamaica, has reported that 25,000 strokes occur annually in Jamaica. Victims are usually individuals in their most productive years of life. Despite the severity of this disease, Jamaica lacks not only the proper facilities for acute stroke treatment, but very importantly, a mechanism and network for the education of stroke prevention. Our own focus within Grace Kennedy Foundation of forming alliances and partnerships as a means of bringing about lasting social and economic change at the national level makes us proud to be associated with the Jamaica Stroke Alliance. The strongest motivator, however, for our involvement is the human factor, the realization that our contributions will make a difference in the lives of Jamaicans in the prevention of suffering and disease. Both the Foundation and Grace Kennedy and Company Limited very strongly endorse this initiative, and we have demonstrated our support by way of monetary contributions, human resources, and expertise. On behalf of Senator Don Webby, Group CEO of Grace Kennedy, and the Board of Directors of the Foundation, I should like to thank Mrs. Caroline Mafood, who is CEO of our foundation, and her staff for their tremendous efforts in assisting with this launch. We should also wish to commend the vision and dedication to this cause of Mrs. Hilary Webby and the newly formed Board of Directors chaired by Mr. Simon Roberts, and to congratulate you all on the launch of this initiative so critical to the health and well-being of such a large segment of our Jamaican population. Thank you very much.
Thank you, Dr. Kennedy, for those words, highlighting just how important this organization is, and also just how important corporate support for an initiative like this is. We cannot do it without the assistance of corporate Jamaica. As Senator Webby always says, it takes cash to care, and it's not just the financial support, but also the resources. And so we thank you for those words. We thank Grace Kennedy for its support and commitment, and we also extend the same gratitude to the Jamaica National Group, of which our next speaker is Chairman and CEO, the Honorable Earl Jarrett, joins us this morning. And he is also chairman of the Jamaica Cancer Society, so you can see he cares about health, chair of the Jamaica Diaspora Foundation, and now thankfully the Jamaica Stroke Alliance can benefit from his expertise as he serves on the board of this alliance as well. And so we welcome you, Sir Jarrett. Good to see you this morning, and thank you for being here. And we hand over to you now for your input to this morning's event. All right, I'm going to ask you to unmute your mic so we can hear you.
Okay.
Awesome. Good morning.
Okay, good. Good morning to you. Thank you again, Master of Ceremony, Simone, Dr. Fred Kennedy, Chairman of the GK's Foundation's Board, and of course the founder of this Jamaica Stroke Alliance, Mrs. Hilary Webby. It is a pleasure to be playing a part in a role this morning in the launch of the Jamaica Stroke Association. The establishment of the Stroke Association is very timely, as the Jamaican population has been affected for many years by the impact of stroke on individuals and their families. And the country as a whole has also suffered as a result of stroke affecting so many of our population. If you should ask any member of the Jamaican community about their health status, you may get the following responses. I might have a little pressure, they'll say, or I have a little sugar. This response is common, but not just in Jamaica, but also in the entire Caribbean area. And the general responses leads us to the issue of stroke, hypertension, diabetes, and obesity. Jamaica, unfortunately, has a high prevalence of these diseases, which disproportionately affect the Black people around the world. But in Jamaica, the Blacks make up about over 90% of the population. The reason for this is often sometimes linked to lifestyle, and particularly diet and weight, and the weight of people, and the levels of physical exercise, and in some instances, genetics. The WHO's World Health Organization analysis indicates that in 2008, approximately 25% of Jamaicans between the age of 15 and 74 are hypertensive, and 13% of all deaths in Jamaica were caused by strokes. The data does not account for the impact of stroke on the lives of the survivors, who may experience paralysis, speech impairment, and cognitive impairment. The financial cost of the treatment of a stroke and long-term care can be a financial catastrophe for the individual and families. The fact is that oftentimes the person affected may not be able to resume his normal job, and the loss of income to the family may result in changes in the lifestyle and life chances of those persons and their entire family. A stroke oftentimes leads to mental depression, and the need for counseling has to be addressed. I bring you greetings today as someone who has experienced a stroke. On September 6, 2017, I had a stroke. I was in a meeting at the PSOJ on Hope Road, which, as you know, is close to Andrews Memorial Hospital. I experienced a lack of movement on my right side and an inability to speak. Persons in the meeting quickly realized that I was in problems, and they quickly took me to the Andrews Hospital, where I was admitted and stabilized, and then transferred to University Hospital of the West Indies, where they then went through a series of tests to determine what was the next step in my treatment. So I have had a direct experience with stroke, and I know firsthand exactly what it can do to you and your family. And therefore, it is in that context that I am serving on this, or supporting this organization, and serving the organization as well. After University Hospital people did their assessments and determined what was the course of treatment to be applied, I then had surgery and rehabilitation. And I'm today, and what you see today, I'm here today, is a result of those early decisions made at the start of my episode. And so the need for fast response. And when I say fast response, it's an acronym for the approach taken or the protocol adopted, where you look at the person's face and determine whether there's any change in the face. You look at the person's arms to see whether there's any impairment in movement. You look at you listen to the person's speech to determine whether there's any impact there. And then the T in fast is related to time, the timeliness that it takes to get treatment, which is what makes the big difference in the outcome for persons. In my case, there was an alignment of all the actions that were required, in that the person in the room recognized there was a problem. They moved swiftly to take me to the Andrews Hospital, then moved swiftly to the University Hospital. During my journey, I became acutely aware of the importance of neurologists and the medical teams, and the work of therapists, inclusive of physical, occupational, and speech therapists. I also learned of the importance of assistive devices to ensure that I had mobility when my body failed to provide that mobility. These assistive devices, wheelchairs, walkers, and other devices are very expensive in Jamaica. And there's a need to make these devices more available to the Jamaican population. The cost of a stroke can be a devastation on the financial health of a family and the individual. The cost of care can be enormous, and the fact that in some instances you may never be able to resume your jobs. So for many Jamaicans, many Jamaicans just simply cannot afford to be fully healed. I intend, and my organization, Jamaica National, intends to support the Stroke Association in their endeavors to make stroke not a permanent issue for many Jamaicans. But if we can get persons to respond quickly, to provide the right therapy, then the outcome can be very different. As I said earlier, I'm here today speaking and functioning because of that speed at the start. And so for me, I wish for the organization every success, and I will do my part to ensure that it is successful. And I congratulate Mrs. Webby for driving this organization so far, and for Simon Roberts, who has volunteered with a little bit of help to chair the organization. And of course, the Grace Kennedy Foundation, Mrs. Kylie Mafood, and her team for the efforts in bringing it to fruition this morning. So with that said, again, I wish you congratulations, and I wish the organization every success. Back to you, Master Chairman.
Thank you very much, Sir Jared, and thank you for sharing that. We weren't sure whether we ought to have said anything, but I can tell you that on September 6, 2017, when Jamaica heard what had happened to you, we all held our collective breaths. And we thank you for underscoring the importance of early action. It shows where you are today. You said your life was ostensibly saved by the fact that the people around you were thinking quickly and could get you the help you needed fast. So thank you for not only the testimony and for sharing your story, but for now putting your energies into the success of this organization, not only personally, but through the work of the group, which you now lead. God bless you. We are so, 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 so happy to see and to hear you and to know that you are well and you are living proof of what can happen when we act quickly when someone suffers a stroke. So thank you again, Mr. Jarrett, for being here this morning, and thank you to the JN Group for its support of the Jamaica Stroke Alliance. Good story there to take us into our next speaker. I mentioned to you at the top, and Sir Jarrett just underscored how important it is for quick action. Strokes in Jamaica, one of, if not the leading cause of death, and what we can do to help avert that as the outcome will come through the Alliance. Information on heightened awareness and how we can act to ensure that our loved ones are safe. That's where our next guest, Dr. Kimmy Kawa Morgan Channer, comes in. Dr. Kimmy, as she is affectionately called, is the acting chair of the Jamaica Stroke Alliance, an internal medicine consultant, ABIM certified, an American College of Physicians IEP Fellow awardee in stroke and vascular neurology at the University of Miami, Jackson Memorial Hospital Stroke Center in Florida. She is presently the Senior Registrar and Acting Consultant at the Kingston Public Hospital and Honorary Consultant at the University Hospital of the West Indies. Her passion is stroke education, and she hopes to improve stroke care and to prevent strokes in Jamaica. And we are sure to see that passion play out in her presentation, which comes up now. Dr. Kimmy, it's over to you.
Thank you, Simone. Welcome, everyone. It is a pleasure to have you all at the launch of the Jamaica Stroke Society. I want to welcome you all. It is a pleasure to provide an overview of the Jamaica Stroke Alliance in the position of acting chair. I stand in for Mr. Simon Roberts, who is the chairman of the board of the Jamaica Stroke Alliance, who is recuperating from a recent illness. So what's the background of the formation of the Jamaica Stroke Alliance? It's based on evidence, data, and the data that we're going to explore today is Jamaican data. I want to let you guys know for the next slide. that the data is kind of sparse. I would say there's a paucity of stroke-specific research in the Jamaican population. But what we do have is a combined study showing in 2004 that heart attack and stroke, which is cerebrovascular disease as well as cardiovascular disease, has been the leading cause of death in both men and women in Jamaica. But the next slide, we will see that there's this pie chart where stroke is far more greater than the occurrence of heart attack. This is from the 2007 and 2008 Jamaica Health and Lifestyle Survey. They found that 25,000 Jamaicans reported having some history of stroke. And so that was worked out to be 2 times that of heart attack. So stroke really has to be brought forward in the minds of Jamaicans to prevent and also to have the best treatment available for them. In 2016, WHO reported that 30% of Jamaicans with premature deaths were due to cardiovascular disease, that's heart attack and stroke. So put that in perspective, that's more than chronic respiratory disease, that's even more than cancer. It's even more than premature death due to diabetes. For the next slide, we will see the data from the Jamaica Health and Lifestyle Survey of 2016 to 2017. Here we see 57% of Jamaicans have hypertension. And though 10% have diabetes, if you just look at the elderly population alone, 42% of our elderly have diabetes. 54% of our population has obesity. This is significant. As mentioned before, it can have economic effect, devastating proportions. And so we all know all of these are risk factors for stroke, and we can do something about them. That's the point here. So all strokes that are preventable, our vision is to prevent them. As an alliance, we want to provide for those affected by stroke a healthcare system that has access to quality stroke care, treatment, and support to promote that. For our mission, we want to reduce the burden of stroke to patients and caregivers. And we hope to accomplish this by 3 main focus areas: stroke prevention by increasing awareness for stroke prevention, early recognition of stroke, and stroke care among the population, the general population, health professionals, and through healthcare systems. Fostering access to quality stroke care and treatment. And we want to provide stroke education in collaboration with public and private organizations. That's through conferences, seminars, and even community-based programs. For our next slide, you will see that we have a network of a wealth of experienced consultants and experts. And so they are fueled with the vision that we can impact stroke care. With our next slide, what we can do is our message. What can you do? We can learn the warning signs of stroke, because time is brain. You lose about 1.9 million brain cells every minute after a stroke. So we need to get people to a hospital urgently. So spread the word. And we want you to be advocate. If you look at our next slide, here you can spot a stroke using this acronym. The acronym is B FAST. B is for loss of balance or loss of coordination. E is for eyes, loss of vision in one eye or double vision or loss of vision for both eyes. Face. If you have drooping of this one side of the face or facial numbness on one side or a droopy smile, this is a sign of stroke. Arms, sudden onset of arm weakness or even leg weakness. this is a sign of stroke. And speech difficulty. You ask a person to say a simple phrase like, the sky is blue. If they're having difficulty, if they're slurring of the words, this is also a sign of stroke. And therefore, they need to get to hospital immediately because time is brain. So call an ambulance, call your relative, call someone to take you to the hospital, or call someone for that person to take them to hospital. Learning the signs of stroke and acting fast can do wonders for that person. And then advocate. You see, Jana says, no voice is too soft when that voice speaks for others. And that's what Jamaica Stroke Alliance is all about. And we hope you will partner with us. So here's some ways you can get involved. Learn how to volunteer or donate at our website. You'll see it on the next slide. And also you can email our secretariat at the email below. We want to really thank you for making the time to be here, because we know that stroke can be impacted by your choices and the choices of all Jamaicans to do better in terms of advocating, learning the signs of stroke, and taking care of your risk factors for stroke. Thank you.
Thank you very much, Dr. Kimmy. I mean, I've often heard the phrase time is money, never heard the phrase time is brain, but how potent and how profound a phrase, and how important it is for us to understand that. Learn the warning signs of stroke, key takeaways, and act fast, be fast, because it can make all the difference. And I love that quote, Dr. Kimmy, no voice is too soft when that voice speaks for others. We can definitely say that this next lady has used her voice to speak for others, especially through this alliance, which is a manifestation of a couple of years, maybe 3 years of work that she has been doing dedicatedly on this initiative with the support of others whom she has involved in making this come to life. If we were to have a guest of honor today, I'm seeing that my internet connection is stable. I hope I do not fall. If we were to have a guest of honor today, it would be this lady. She is ostensibly the reason we are all here this morning. Mrs. Hilary Webby, a retired business manager who spent her career contributing to the growth and development of Grace Kennedy Limited. Now a stroke survivor, she has dedicated her time and her life on the education of how individuals can live their best lives. Jamaica Stroke Alliance, and I can only imagine how emotional a day this must be for her today to see this project come to fruition. A lot of you in the chat, in the comments, were saying we can't wait to see Mrs. Webby, and you are congratulating her and just the strength it has taken for her to pull this off and her commitment to pulling this off. We'd like to share with you now her story so you can see a little bit of her journey since she suffered her stroke. So let's run that now.
I had a stroke November 11th, 2015, and it was really scary. Actually, it was so sudden I didn't even know it was happening. It was like a light switched and I woke up and found out I had a stroke. The stroke left me paralyzed on the left side, no movement in leg or arm. Face was twisted, couldn't look to the left side.
I was only 12 years old, so I wasn't fully cognizant of what was going on. Dad was in Otrius on a business trip, so mom was the adult at home in charge. My brother and I were home. My brother is 12 years older than me. So I was in my room and he knocked on my door. He usually gives me my privacy, and he kind of like pushed open my door, so I immediately knew something was wrong. And then he said, Abby, calm, something's wrong with mom. So me, Nicholas, and mom were in the room, and we were trying to figure out what was going on because we've never had any experience with any kind of medical emergency. Everybody in our family has been pretty healthy, so this was completely new to us. We were very scared, and dad wasn't home. We called grandma, we called both grandparents, we called dad. We weren't getting through to dad at first. Her arm was weak, so I was like, did she hit her arm? And then her speech was slurred, so I was like, did she bite her tongue? And then when it finally occurred to me that the only thing that could be causing such havoc in her body was her brain, then I knew it was something serious and we had to take control. So we got her in the car and we drove her to Andrews Hospital. Dad met us there and he reached about midnight. This was about 8 o'clock in the night, if I remember correctly. He met us at the hospital by about 11 o'clock, and later we were informed that she had had a stroke.
My life after having the stroke has been completely different. It has changed it in every way. I mean, if half your body is paralyzed, I had to learn to walk again. I had to learn to sit up in the bed by myself again. So it's a long, long, winding road back to recovery to be able to function again. Took away my independence, which is the most significant impact. Haven't been able to drive again, work again, walk properly. Well, I spend a whole lot of time in therapy at the moment, trying to recover function and be as independent as I can.
I still didn't understand how it would impact my life, both negatively and positively, but we tried to turn the negatives into positives. Mom took me to school every single morning. She took me to dance class, she went to the supermarket, she tied that tie. She was just in charge of the household. All of these things that seemed like they did themselves suddenly had no dominion. So it was very scary. Everybody had to take their role in the house. Anything that we could do, I started going to the supermarket. Dad started taking me to school, and it was hard. It was hard to see my dad feeling this way. It was hard to see my grandparents feeling this way. It was hard to see my siblings feeling this way. I've never seen every single person I love in such agony before, and it was so heartbreaking. Just because even though I could tell that something very serious was going on, I could tell that I might lose my mom, and it was heartbreaking for me, but seeing everybody around me feeling the same way was just so hard, and you had to just be strong for everybody.
Well, my number one support system is God. I'm a member of a weekly Bible study, and that provides a whole lot of, spiritual strength for me. I have a very close-knit family. My parents, my husband, my children, my siblings. So I'm very fortunate to have a very strong support system. And I have encouragers who send me inspirational messages every day. 2 people have sent me inspirational messages for every single day for the last 5 years. Well, I think that I have a lot of hope because of my faith. It gives me hope that I will eventually recover a lot of the function that I have lost. I'll be able to swim again, I'll be able to walk in sandals again, and be able to make the fullest recovery that is possible. When I realized how many people in Jamaica have strokes and how many of them are likely not to have the level of support that they need, I thought, I was moved to think, God really placed in my spirit to start a foundation or some form of support organization to help stroke survivors who do not have the support they need. When I realized the amount of things that I was being told that I'd need, and I saw from my own parents the sorts of assistive devices that they needed to be able to live the best life they could, whether it be a wheelchair, whether it be canes, braces of different types. It made me realize how extensive the needs are going to be. The grab rails that you need to have to be able to get up. The things you have to do to adapt your own home, railings to help you to maneuver around safely. It really made me open my eyes to the sorts of changes that people need to make in order to be able to live a productive and, useful life.
My mom is a superhero. She has come back and stepped back in like nothing ever happened. She is so strong, she's so supportive, she's so compassionate and kind. And no matter what happens to her, she's always there for other people. So going back to regular life for her and recovering, she's taken it like a boss. And I'm so proud of her.
So very beautiful. My mom is a superhero. Getting back to normal, she's taken it like a boss. Her book, by the way, Mrs. Webby's book, is My New Normal, Reflections of a Stroke Survivor. So she's been busy not only documenting her experience, but also trying to make a difference in the lives of others, to let them know what they can do after having suffered a stroke, to live the best life that they can after. And not only does that video show you that element, but also just how impactful it is on the family, the folks around the person who suffers a stroke. And so we thank Abby for pouring out her heart, and we thank you, Mrs. Webby, for your strength of character, your spirit, your determination, and your will to, even as you go through this, to be looking out for others. I want to ask you, Mrs. Webby, if we can see you. Can we see you? There are lots of folks in the chat who want to see you. Your video is off and your microphone is off. I'm going to wait 2 seconds to see. Hello there. Good morning. May we ask you to take your microphone off mute? I'm telling you, there's so many comments coming in for you, Mrs. Webby. I can't keep up. An inspiration to us all. Proud of you. Wonderful testimony of strength. Wow, truly inspiring account. Thank you for that powerful testimony and your ministry. Mrs. Webby, I want to give you the floor for anything it is that you have to say to us this morning, anything you want to impart. Even as I look through the comments and try and send on the messages, I know folks want to hear from you this morning.
Good morning, Simone, and good morning to all the people who are tuned in. All I can say is that it's a privilege to be able to be generous, and it's a privilege to be able for God to use you. So
Wow.
I'm just a vessel. I'm just privileged to be able to be used.
Awesome. Well, say no more. Short comments, but you know what? Without vessels, absolutely nothing would happen. And we thank you for being able to be that vessel to bring about what we know is going to be blessing and change in the lives of many who have gone through what you have gone through. I'm seeing comments from Minna Israel says, Hilly, this is your darling Minna. Sending hugs and so much love. Hillary, you are an inspiration. Thank you for working for the initiation of the Stroke Alliance, and I truly wish you God's blessing. That's Elizabeth. And so many more coming in, Mrs. Webby. We're going to pass them on to you after the webinar, because we'd spend the whole time giving you the messages if we were to just stick to that. But God bless you and thank you so much. God bless you and God bless your family. And thank you for doing this life-changing initiative for Jamaica and for Jamaicans. All right, folks, we're going to keep it moving. From Mrs. Webby's story now to the context of the broader organization. The World Stroke Organization supports and engages with patient stroke support organizations globally, acting as their focal point and facilitating knowledge exchange to assist stroke advocacy and long-term care. We're pleased this morning to have the International Development Manager of the WSO, Ms. Sarah Belson. She has over 20 years of international development experience, and she's been the International Development Manager of the World Stroke Organization for some 5 years now. We welcome you, Ms. Belson. Thank you for joining us this morning. The floor is yours.
Thank you so much. Can I just check you can hear me okay?
Yes, we can.
Great, thank you. So that's a very hard act to follow, Hilary. I mean, really, really inspirational. I just want to say thank you so much for inviting me to say a few words today. It's my absolute pleasure to join you for the launch of the Jamaica Stroke Alliance on behalf of the World Stroke Organisation. And what a day to have your launch, the World Stroke Day, when we see so many people from across the world, stroke survivors, family members and health professionals, come together to raise awareness of stroke and to gather in solidarity for all people affected by stroke. The World Stroke Organisation is the only global body solely focused on stroke. We have about 4,000 individual members and nearly 100 society members that span every global region. We collaborate with people affected by stroke and medical professionals. And each year globally, 14 million people suffer stroke and 80 million people have lived experience of stroke. Stroke is a leading cause of death and disability. And the World Stroke Organisation mission, which is aligned to the Jamaica Stroke Alliance, is to reduce the burden of stroke. For us, that's on a global basis, and this is through more effective prevention, better treatment, and long-term support. And a key priority of the World Stroke Organisation is to support the development of stroke support organisations, such as the Jamaica Stroke Alliance. So stroke support organisations are non-profit organisations that globally drive better outcomes in stroke prevention, treatment and long-term care, alongside the work of health professionals. And the World Stroke Organisation sees the work of stroke support organisations as vital because they help people who make decisions about stroke care understand what is important to the people affected by stroke. They provide long-term support for people affected by stroke that nobody else can or will provide. They advocate and act on behalf of people affected by stroke. They help campaign for change and influence government policies. And they help stroke professionals communicate better with people affected by stroke. So the Jamaica Stroke Alliance is the World Stroke Organisation's only society member from Jamaica, and we value that and we're very pleased by that. And we want to build our collaboration by raising the profile of your work in Jamaica with our global network, by enabling you to access tools and resources and knowledge from across the global network, and by facilitating your engagement in the World Stroke Campaign and in the Global Stroke Network. And finally, on a personal level, I just really want to be grateful and show my gratitude to Hilary and to her for reaching out to the World Stroke Organisation and to me. So I've been connecting with Hilary since July 2017, and I'm so moved to be here today to see the realisation of her goal. I looked at the first communication we received from Hilary over 3 years ago, in which she said, "I would very much love to start a stroke foundation in Jamaica to support and educate stroke survivors. I'm very interested in exploring some of the strategic relationship so as to learn from and make available to my fellow Jamaicans some of the educational tools and resources that you offer." And here we are today. The Jamaica Stroke Alliance is established, and we are embarking on a long-term relationship through which we can together reduce the burden of stroke. I just want to send my very best wishes to Hilary and to everyone that's been involved in the Jamaica Stroke Alliance on this really exciting and important day. Thank you.
Thank you very much, Ms. Beston, and thank you for being here this morning. I know it's exciting for you as well to see this come to fruition. Having, 3 years you've been talking to her about this, and today we give birth to the Alliance, and we know great things will come from this. I want to say good morning again to all the folks who are joining us via this webinar. We have 142 participants on. I'm trying to monitor the chat as well. Good morning, Dr. Bruce, sits on this Alliance's board as well. I see you there, giving your information. You're getting a lot of pledges of support, Mrs. Webby, from folks who are interested in serving in whatever way they can on this alliance. So it's good to know you're building up an army even as we launch this morning. I want to invite the members of the media, if there are any on with us this morning, to ask your questions in the chat. We're going to have a Q&A, a brief Q&A at the end. If there's anybody else who has questions, if time permits and we can take it, then we will try to do so. So you can just type your question in the chat, who you are, where you are asking from, identify your media house or your organization if you're not in media, and we will try to see if we can include your question this morning. So very touching account there earlier from Abigail Webby about what she saw her mom going through after her stroke. We have another account that we want to share with you this morning. And no matter how many times I meet this young man or hear his account, it moves me. His name is Jazeel Martin. And Jazeel had to learn how to balance his life as a law student, as a holder of multiple jobs, and as a caregiver to his mother, who had a stroke. And after being offered many scholarships to study at Ivy League universities, he had to make the very difficult choice
Hi, I'm Jazeel Martin, the son of a janitor, a household helper, ancillary member of various organizations, but nonetheless a phenomenal woman. Her name is Pauline Roma Horn, my mother, who suffered a stroke in May 2012. So 8 years ago, I was preparing to sit my final CAPE exams at St. George's College, and it was a break before my next exam, and I heard, "Help, help, help, help." And that was my stepfather calling, beckoning from their room. When I got to the entrance, it was obvious that my mother had suffered a stroke. Her hand was hanging off the bed, her face was twisted, and this actually was the third time she was hit by a stroke. So terrified we were, we got her out of the bed and rushed her to the University of West Indies Hospital, where it was actually confirmed that she had a stroke, a massive stroke. The prognosis was that it was so bad that they didn't know if she was actually going to make it. Fortunately, she is currently here with us, but the process was such a very difficult one. I remember while I was sitting my CAPE exams, I had just received scholarships to attend universities at about 5 Ivy League universities in the United States of America. And I was torn because my mother had this massive stroke which affected her. Being the sole breadwinner of my family, no father around, no financial support, I had to make a decision whether I was going to leave my mom in Jamaica to go and study at an Ivy League university in the United States. But the decision was an easy one to make. I decided to stay in Jamaica and take care of my mom. And so that caused me to become mature, to become a man. I mean, I may have thought I was a man when I was a teenager, but that was like newsflash. I definitely had to grow up. I accepted my offer to study law at the University of the West Indies. I had to get a job. In fact, I worked 3 jobs trying to send myself through law school and also taking care of my mom. Caring for her, I had to become a nurse. I had to read about stroke and I had to read about patient care. I would change her diapers. I would help to shower her. I would feed her through a gastric tube. I did all of that while transitioning from my high school studies to university and throughout college until she started to improve. So it was devastating. I mean, emotionally, it was draining. It was draining to see, my mom, my world, my everything, being in such a desperate and helpless position when she was always in great control. It's been 8 years and my mom's recovery has been good, but it has not been the best. And I think that's attributed to the fact that we were not financially sound. At the time, though we could afford physiotherapy, that's essentially all we could afford. My mother's speech was completely gone and we couldn't afford speech therapy or occupational therapy. And I feel like if we had that support to assist with therapy in the initial stages, her speech would have been more advanced than it is right now. And you know, it was heartbreaking for me recently when my mom messaged, well, she called me and told me to come over. There's something bothering her. And I went home and she said, you know, boy, son, I just want my speech back. That's all I want. Her right arm is not back, it's not moving. And she says, that's fine, I don't care about that, but I want my speech back. I want to be able to communicate. And right now, that's my top priority, which is trying to get her the best therapy that I can to try to assist to bring her speech back to perfection. But if not, as close to perfection as can be. For anyone who had a loved one suffer from a stroke, they know it's an extremely expensive process. And if you don't have health insurance, you essentially are going to eat dirt. And for an illness which affects so many people in the population, it's unfortunate that the access to proper health care was so difficult, and also the cost for the healthcare was so difficult. And I think that's something that we definitely have to approach on a wider level, on a national health policy level, where the necessary resources are pumped into the health sector in treating with people who suffer from stroke to ensure that they get early diagnosis to determine the type of stroke that the victim would have suffered from, to then determine the right prognosis, medical treatment going forward. And I feel like the current health system is lagging in that respect, where it's taking too long for someone to be diagnosed, to determine the type of stroke, to then treat accordingly.
All right, thank you very much, Jazeel. Guys, if you see me, folks, if you see me disappear, just you know, like just keep going. I will try to come back. Somebody just said to me, Jamaican internet won't just say it. I'm still trying to be great despite. Jazeel, what a powerful account. Thank you for sharing that. A young man doing his best to ensure that his mother is okay. Caroline just typed in the chat that oftentimes we don't think about the impact on the caregiver, and Jazeel just very kind of, you know, candidly put that out there to show us that this is hard on not only the person who has suffered the stroke, but also experienced the stroke, but also those who are left to care for those folks. So Jazeel, you have made some very astute observations and some very interesting points, some of which touch on policy, some of which touch on a national program. And I think it's a good place now for our minister to come in. The Honorable Juliet Cuthbert-Flynn is a very committed and passionate leader. She's been serving her country with distinction since she was 16 years old. Doesn't look a day over it now, I tell you the truth, and that's largely because of how she lives her life. A 5-time Olympian, Minister Cuthbert-Flynn has been a lifelong advocate for a healthy lifestyle, and she practices what she preaches. She's been Member of Parliament for West Rural St. Andrews since 2016 and is now our newly minted Minister of State in the Ministry of Health and Wellness. I know it's been a steep curve, but we know if anybody can run up it, it is you, Minister. We welcome you. We thank you for taking the time to be here this morning. We know your schedule is heavy, and so we appreciate you being here, and we invite you now to give your remarks.
Thank you so much, MC Simone Clark Cooper. I'm very happy to be here this morning, especially to hear the 3 inspirational stories and possibly so many more out there in the Jamaica land we love that we are not aware of. But for sure, Mrs. Hillary Webby, her story, Honorable Earl Jarrett, his story, and all, again, to hear Jazeel and his inspiration, that it was just really touching, giving up, studies overseas to take care of his mother. And so it really shows us that we need to improve our healthcare system. And I think that is possibly why I'm here this morning. But again, let me thank everyone. Honorable Earl Jarrett, Chief Executive Officer of the Jamaica National Group, Dr. Kimika Morgan Channer, Acting Chair, Jamaica Stroke Alliance, Mrs. Hillary Webby, Founder and Board Member of Jamaica Stroke Alliance, Member of the Board of the Jamaica Stroke Alliance, Ms. Sarah Belson, all the way in the UK, Dr. Fred Kennedy, Chairman of Grace Kennedy Foundation, Bridget Levy, Advisor to the Jamaica Stroke Alliance, distinguished guests, and I heard Simone asking if there are any members of the media out there. Good morning to you all, and thanking everyone for the invitation and for me to participate in the official launch of the Jamaica Stroke Alliance, which has a mission to raise awareness and education of stroke prevention and care among the population in collaboration with the public and private sector organizations and advocate for access to quality care and treatment. And I think that with everything that we've heard, that is very important. We are particularly drawn to the organization as your mission speaks to a partnership, which is the bedrock of any public health system. Now more than ever, there is greater need for partnership and alliance as the world continues to combat one of the greatest public health challenges, which is COVID-19. And even as countries around the world zone in on COVID-19, the renewal call to focus on our overall health and the prevalence of non-communicable diseases, NCDs, has become even more relevant, as persons who also suffer from comorbidities have a higher fatality rate when compared to others. Despite the international focus on NCDs over the past 2 decades, Jamaica has continued to experience an unacceptably high prevalence of cardiovascular disease, including stroke. According to the latest WHO data published in 2018, stroke deaths in Jamaica reached 2,479, or 13.62% of total deaths. This age-adjusted death rate is 65.41 per 100,000 population, ranks Jamaica 100th in the world. Of course, this catastrophic condition, stroke, usually starts long before the actual catastrophe. Many factors contribute to stroke, including gender, family history, ethnicity, certain heart disease, high blood pressure, diabetes, high levels of bad cholesterol, which are affected by lifestyle activities, including cigarette smoking, excessive use of alcohol, sedentary lifestyle, excessive salt, high sugar intake, and psychosocial stresses. The question then is, are we to be concerned about these factors and lifestyle conditions? And I think the answer is definitely a big yes. Findings from the Ministry's Jamaica Health and Lifestyle Survey in 2016-17 amongst the Jamaica 15-year-olds showed a very, very sick health profile of our population. More than 3 out of every 10 Jamaicans have hypertension, which is 34%. Hypertension rates are 25% higher than 10 years ago and 50% higher than almost 20 years ago. 1 in 10 Jamaicans have diabetes, and the diabetes rate are 25% higher than they were 10 years ago. 15 out of every 100 Jamaicans smoke, and more than 1 in 4 men smoke. More than half of the Jamaicans are overweight or obese, and more than 80% of Jamaicans do not exercise enough, and more than 60% of the Jamaicans do not consume sufficient vegetables. All of these findings indicate that the Jamaican population is high risk for stroke. Therefore, as a Ministry of Health and Wellness, our plan of action towards the strategic management of stroke has to bear this health information and the following pillars in mind. It must be anchored by strategic lines tailored to reduce prevalence of risk factors, to identify persons at risk, to build capacity, and to perform early diagnosis and capacity to mitigate the risk of death and disability from stroke. These strategies require a change in culture and should be applied to all levels of care, but must also extend beyond our healthcare and must involve an all government approach. The number one strategic direction for the Ministry of Health and Wellness is primary prevention. And what is that? Daily exercise remains a proven intervention in the risk reduction of cardiovascular disease. Jamaica and the Caribbean continue to observe progress in measures to promote physical activity and healthy eating. And we have seen the Jamaica Moves program has been implemented in schools, workplace, and community settings. And we look to a full integration of the program into the health system. It involves, of course, the three-pronged approach of physical activity, healthy eating, and self-awareness of your numbers, which are your blood pressure, your blood sugar levels, and of course, your body mass index, amongst others. And the others are sugar restrictions, the active campaign against excessive salt, and that we must take serious. A lot of these places that we eat out, I think they use excessive salt, and reading of the food labels. And I know that there is a push at this time with the Heart Foundation to get that out, and also a push here at the ministry to make sure that we have proper food labels on our packages in Jamaica. Other urgent interventions are ongoing and need to be further advanced. The second strategic direction is to further strengthen our primary care for early detection and better management of major risk factors such as hypertension and diabetes. The greatest scope for improving outcomes through individual services is through further strengthening of primary health care. Screening and treatment guidelines already exist and are being utilized. The specific areas where work continues include mainstreaming comprehensive cardiometabolic stratification in primary healthcare, improving detection, enhance registration and management of hypertension and diabetes according to established national guidelines. Also, strengthening effective secondary prevention in high-risk patients. The most significant actions to be given priority over the next 2 to 3 years from the ministry are to fine-tune and scale up the model of care. And these include increasing access to essential medicines and information systems for health to ensure continuity of care, which is very important. Also to strengthen of the referral system to enable the patients referred for specialist care are seen on a timely basis, and utilizing private practitioners in the care of patients with hypertension and diabetes. Some of these actions are already in train, and we can expect to hear some more in the coming months. The third strategic direction is to improve the response to acute complications of stroke and strengthen secondary and tertiary prevention in secondary care. The challenges to achieving extensive coverage of acute care after strokes are significant and major investments are required to overcome them, but we must. It is critically important to recognize that investments alone will not lead to desired outcomes unless actions are taken to improve patient engagement, service delivery models, regionalization of service, and capacity of ambulance staff and hospital providers in order to respond to patients with symptoms of a stroke. The most important actions to be given priority over the next 2 to 3 years are as follows. Establish a national clinical practice guidelines on the early diagnosis, acute care, and rehabilitation of strokes. And I heard quite a number of persons, especially Jazeel, speaking about this. To improve first response, which is response time and quality of care after suspected stroke. This can be achieved through population education about the symptoms of stroke, strengthening the capacity of the ambulance services, standardizing pre-hospital care, equipping ambulances with ECG, defibrillators, pulse oximeters, and glucometers. Emergency medical technicians should receive regular continuing medical education with priority given to stroke care. Institute capacity to differentiate strokes which are caused by blockage or rupture of a blood vessel and enable administration of clot dissolving therapy at each or at least at the regional hospitals. To also consider brief 1 to 3 months cross-training of internists so that they can provide stroke care in regions without a specialist, with additional support from specialists at the tertiary level. We must also apply and promote facility-based audits of stroke care delivery, which I think is very important, with quality indicators based on established national clinical practice guidelines. And last, training at least a base level of numbers of physicians to be able to better follow up on persons at risk. Now, the final strategic direction for the ministry is to allow for a cultural support of stroke rehabilitation even after a stroke has occurred. The patient outcome can be improved if appropriate steps are taken. We heard this with all of the persons who gave their testimony this morning. And these steps are taken systematically to optimize recovery and function of the injured brain. The cultural shift must also include some of the very preventive strategies, which we can look at smoking cessation, avoidance of excessive use of alcohol, salt restriction, management of blood pressure and diabetes, prescribe and supervise exercise. The most significant actions to be taken, to be given priority in the very short term are as follows. To establish adequate capacity for follow-up of all persons post-stroke in communities, which is important. To increase physiotherapy in primary care towards stroke rehabilitation. This is currently being done as a pilot at pilot sites across the island, but we must push this to move forward. Training community nurses and community health aides to follow up on these persons. The government of Jamaica, through the Ministry of Health and Wellness, has a plan for persons who may suffer a stroke and that is not lost on us. We need the support and partnership organizations such as the Alliance, the Grace Kennedy Foundation, and many others in order to combat this condition and associated risk factors. Again, let me congratulate this morning the Jamaica Stroke Alliance on its official launch. And I think, again, this is so needed in in Jamaica. The ministry looks forward to our collaboration as we look to work together for the best health outcomes for all Jamaicans. And again, I would like to express a huge congratulations to all. And I think that this launch this morning will serve us well. And I will definitely stay on top of all the things the ministry say that they will be doing to make sure that it is definitely brought forward. I thank you so much for having me this morning.
And we thank you, Minister, for being here and for your comments this morning. Good to know that there are initiatives being looked into and to be implemented not only at the national level, but at the community level, which is also very important, also for our caregivers, for our EMTs, also critical. Strengthening of primary care and secondary care, also critical as we look to improve the response time and quality of care for our Jamaicans who experience a stroke. Thank you again, Minister, for your time, and we look forward to your partnership and your commitment in working with the Jamaica Stroke Alliance. We move on now, folks, as we're almost at the end of this morning's proceedings, to our next speaker, who is an advisor to the Jamaica Stroke Alliance. She's a social policy researcher and consultant, but more importantly, she can speak very definitively to the matter of stroke because she too is a stroke survivor. Bridget Levy, therefore, found it very important to be involved in this initiative, and she's been working with the team to bring this to life because she cares very much about spreading the information on stroke prevention, care, and support, and making a difference for all Jamaicans in these areas. We thank you, Mrs. Levy, for being here this morning and for your work with the Alliance, and we invite you now to give your remarks.
Thanks very much, Dion, and thanks very much to everyone for staying with us this morning, even though we're going a little bit over time. I recall when Hillary called me to say, would I work with her? And we started to conceptualize what this alliance could do. At the time, it was a stroke initiative, but what this initiative could do and accomplish. And I got so excited about the awareness building part. And I'm pleased to say that that's the committee that I chair, the subcommittee, the Behavior Change Communication Subcommittee. So I just want to thank my committee first, Michael Morgan, who is an amazing conceptualizer, Dr. Kimmy, who is our technical advisor, Caroline Mahfood, who is the CEO of Grace Kennedy Foundation, and she just has given us endless support in getting this aspect going. So as a committee, we worked on 4 things, and I'll just present them one at a time. The first thing we worked on was the logo. And I very much would like to thank Calico Production, a team led by Scott Robotham. And just to let you know, we actually had an interim logo, but we got some feedback and we said, maybe we need to make it look different. So we created this new logo that you're seeing here that has the significance of it is we have the red dot that represents blood as well as vascular disease. And the dot is actually in the head of the individual because that's where strokes occur. And there's a web, an intertwining web there, which shows the alliance, because we do believe that we work as an alliance with government, with private sector, with individuals, with suppliers, with people. And so and also that web is to symbolize the caring that's encompassed in the whole work of the Stroke Alliance. And so I think this is just a really amazing logo. Thanks again, Scott. We also then worked on the website. Again, Calico Productions has worked with us to get us to the point. So this is what the website looks like now. The website is an informative website. So it speaks about the Alliance. It gives us information on stroke. So it tells us what the Alliance is. It gives us information on strokes and the effects of a stroke and living with a stroke. But I guess most importantly, the website will give us information on where people can go in the event of a stroke. So where's the closest hospital or center that you can get to? And eventually it will give information on the various networks that operate around strokes. So if you're caring for someone with a stroke, where do you go to get diapers? If you're dealing with someone with a stroke, you might need to get walking sticks and canes and so on. So that's the purpose of the website. It's an informative website that the Alliance will maintain. And we will also have information on advocacy, research, upcoming seminars, and so on. The next thing that we worked on, which I think is perhaps, this one has my heart, was the social media competition. So we worked with the Grace and Staff Foundation and their Camera Club members. We had a half-day workshop with the young people. And I thank the presenters there, Mr. Michael Morgan, Keneal Gale, along with members of the Stroke Alliance board. And we had then the young people who did their work, and they were guided by the Grace and Staff team, Tankita Chance Wilson as the CEO of the foundation, but also Daniil Jarrett, who pulled the videos together, who worked with the young people at the end to pull the videos together. We had 4 judges external to both the Alliance and Grace and Staff. So I need to thank Suzanne Stanley, Jeremy Francis, who is a photographer, Alanis Blake, who is a Grace Kennedy Foundation scholar, who is now subsequently volunteered to continue to work with the Alliance. So thank you, Alanis. And Tanya Wildish, a representative of the Jamaica National Foundation. And they selected the winning entries. Before I show the entry, which I am going to do in a minute, I wanted just to acknowledge all the young people who participated. We had 4 groups of 3 persons. Lativia Dunn, Hermione Atkins, Philip Ritgard was group 1. Group 2 was Pomone Ramsey, Tiamone Harding, and John Pedley. Then from the Spanish Town area, we had Dana Francis, Brandon Sanko, and Courtney Brown. And group 4 was Zalia Williams, Jean-Claude Silvera, and Damali Robinson. And the winner was group 1. Lativia Dunn, Hermione Atkins, and Philip Ritgard. And we're going to play that for you now, that winning PSA.
Hello guys, did you know that stroke is the #1 cause of death in the island? This occurs when a blood vessel leading to the brain is blocked or burst, preventing oxygen flow and causing brain cells to die. People, seek medical attention if you or someone you know is experiencing numbness, dizziness, weakness, or any other stroke-related symptom. So no bother with the excess drinking and smoking. And if you suffer from hypertension, diabetes, or any other underlying sickness, visit your doctor regularly. Remember, your health is your responsibility. Eat healthy, exercise regularly, and take your meds. This is a public service announcement.
Isn't that great, guys? I mean, these are young people, looking in the community. And then we had 3 others who are also excellent, who just don't have the time to show, but we will be displaying them over the coming months as part of our outreach and our PSA programs. And then finally, we actually created some public service announcements. So I would first like to thank Michael Morgan, because it was his creative vision that led us to this point. And I also need to say a big thank you to Earl Jarrett, Tanya Wildish at Jamaica National Foundation, and the Jamaica National Creative Unit led by Roland Watson Grant for executing the following. Play.
Every second counts. In the event of a stroke, spell it out. B, fast. B, check the person's balance. E, are they seeing blurry or only out of one eye? F, is one side of the face drooping? A, is one arm drooping? S, is their speech slurring? T, it's time to call for help. A stroke can strike at any time. Become aware. Be prepared. Visit JamaicaStrokeAlliance.com. A message from the Jamaica Stroke Alliance.
And there's another one that we get to see.
Every second counts. Granny used to say, you better know what a clock a strike. Is your lifestyle putting you at more risk for a stroke? Are you smoking or drinking a lot? Are you overweight? Do you have diabetes or high blood pressure? Are you eating unhealthy foods? Are you getting enough exercise? All these factors put you at risk for a stroke, and a stroke can strike at any time. Become aware. Be prepared. Visit JamaicaStrokeAlliance.com. A message from the Jamaica Stroke Alliance.
Isn't that amazing? I just every time I hear it, I think I'm amazed. I just am so heartened by this information that's definitely been relevant to Jamaicans. You know, what a clock a strike. That's just perfect. I love that. Thanks again to Earl Jarrett, Tanya Wildish, and the Jamaica National Creative Unit for helping us to get that out and going. And so finally, just to let you know that these materials and others that we have will be shared widely in the coming months. Look out for it. Visit the JamaicaStrokeAlliance.org website, join our mailing list, and you'll get all the updates. Visit visit our Facebook, Instagram, and please share all these messages widely so that all Jamaicans can be aware of the signs of a stroke. Before I go, I would be very remiss if I didn't say a big, huge, ginormous thank you to Caroline Mafood and all the staff at the Grace Kennedy Foundation who played such an integral role in supporting us, cajoling us, hearing our complaints, and just fixing everything that we ever wanted. And I just really want to say thank you to them and to acknowledge the great work that you've done for the Alliance and for me personally. And I want everyone, all Jamaicans, to know that when they see someone showing the sign of a stroke, just be fast. Thank you.
Thank you, Mrs. Levy, for sharing. We're glad you're okay. And we see your passion. Yes, we know you're fine. We see your passion.
All of these people did such amazing work and contributed to this, to us having this wealth of resources that we now get to share in so many different forums. I thank them all.
Absolutely. We feel your gratitude and we are grateful as well. And we're thankful to you for your work on this. We know it's a lot of work that goes into our website and goes into establishing information and building a public education campaign. But when you sit and you look at the work you've done and the difference it will make in other people's lives, then you know the work was well worth it. So thank you for your contribution. Yes. Love the PSAs. Congratulations to Latavia and her team. And it's so good that we involve the young people. Love to see the work of the Camera Club, of Grace and staff in getting the messaging out, because in order to spread that word, we have to get our young people also in the know about how this can affect them, even as they move forward with their lives, and plant the seed early and plant the seed of awareness early so they will know how to act. The minister has told us a lot of this is preventative, and where we can prevent it, we ought to work to do so. So thank you very much again, Mrs. Levy. And nothing more to do now than to tie it all together. We're going to invite Dr. Hamza Ali to do that. He's worked closely with stroke survivors for years, now serves as a board member to the Jamaica Stroke Alliance. Dr. Ali is a senior consultant neurologist at the Kingston Public Hospital, having been trained here in Jamaica at the University Hospital of the West Indies, and then overseas with the National Hospital for Neurology in London, specially certified in neurology by the Federation of Royal Colleges of Physicians of the United Kingdom and the Association of British Neurologists. And Dr. Ali, I'm going to add to your resume this morning, a newly minted grandfather. We congratulate you on that. Point of chairperson's privilege. I'll throw that in and congratulate you on behalf of everybody who is on the webinar this morning.
Thank you so much, Simone. Thank you so much. Ladies and gentlemen, while no one wants to hear too much from the person who does closing remarks, there are a few things that I'm glad I have the opportunity to do as we bring today's proceedings to a close. And so I'd just like to reiterate a few final points. The JSA aims to build awareness of early stroke detection by introducing to the wider population knowledge of the BFAST checklist. As you heard, we will check balance, eyes, face, arm, and speech as an easy way to quickly identify the early warning signs of a stroke so that affected individuals can be brought rapidly to medical attention. Remember that slogan that you've heard, time is brain. BFAST awareness will be a national campaign and will be done through public service announcements, social media, and a variety of public-private partnerships. We plan to focus too on strengthening services at hospitals and health centres through training of health professionals, which will be CME accredited, as well as for caregivers and stroke survivors. You've heard this as well. We've established a website called the JamaicaStrokeAlliance.com that will provide information to stroke survivors and caregivers on where to find resources, including where clinics are, rehabilitation facilities, and equipment. There are so many people that have done so much to get us to where we are today, but special thanks are due, of course, to Simone Clark-Cooper for a wonderful job as our Master of Ceremonies today, to Father Ho Long for his reminders and blessings of our organization, to Dr. Fred Kennedy for articulating the important context and relevance of stroke and stroke care in Jamaica, the Honorable Earl Jarrett, CEO of Jamaica National, for your powerful personal testimony and guidance throughout the process, to Dr. Kim Morgan-Chana for your astute clinical insights and research, and also for being such an active and available resource in ensuring the medical soundness of all our communications. Of course, to Hilary Webby, founder of the JSA, for your incredible energy and commitment over the past 3 years, and for your powerful presentation, highlighting one of the most devastating complications, loss of independence, but also inspirationally, how you found a way to cope, and also how you're finding ways to help others cope. To Sarah Belson of the World Stroke Organization for your global perspectives and constant support of our new organization, as well as articulating 3 important components of stroke care, namely prevention, acute stroke care, and rehabilitation. Mr. Jazeel Martin, your perspectives as a caregiver for this chronic medical condition were so meaningful. You highlighted how the family also suffers greatly. What a powerful presentation and how inspirational you are. To the Minister of State, the Honourable Juliet Cuthbert, for your support and time, especially when we know how busy you are, and for identifying the importance, the critical importance of chronic non-communicable diseases as contributors to stroke prevalence in Jamaica, including the fact that so many of these are preventable, such as cigarette smoking and inactivity, but also for articulating how we will address these through primary prevention at a national and community level, including the famous Jamaica Moves program. To Bridget Levy, again a stroke survivor, for your work from an early stage with the Alliance and your focus on behavioral change. An amazing video, and congratulations to all of those who worked on it, and we look forward to seeing the others as well. To all the members of the Jamaica Stroke Alliance board for their voluntary service in building out this organization from concept to launch. To the Grace Kennedy Foundation team, Carolyn Mahfood, Marjorie Godfrey, and Crystal Gale Williams, who almost on their own organized and executed this launch while handling their so many other responsibilities. Diane Roden and Suzanne Stanley from Grace Kennedy's public relations team for their professional guidance, Dale Beckford of their Grace Kennedy's IT team for handling all the technology issues. As you heard from Tanya Wildish from the Jamaica National Foundation for running the Stroke Alliance in the latter part of 2019 and helping us bring it to launch readiness. To Monica Ladd, Peter Golson, and the Miles Fletcher and Gordon team for their legal expertise, again in helping us to become a legal entity. To Bridget McDonald-Levy, Michael Morgan, and Scott Botham of Calico for their creative communication input. Special thanks must be given to Grace Kennedy and the Jamaica National Group, who provided significant seed financing to make this initiative possible, including to Andrew Masado, who approved the donation. Thanks must be given to all the individuals and organizations who will now come on board so that we can reach as many persons as possible. And to my good friend and chair of the JSA, Mr. Simon Roberts, who invited me personally to be part of this in the very beginning, and himself has put so much time and dedication into this initiative. And of course, nothing is possible without God's divine help, to whom all thanks must be given. And very finally, I have recognized so many people in the list of attendees to this virtual event, and I'm inspired by their presence. And I'm so happy that you have joined from near and afar. We thank you all for taking the time to join us on this historic day. and look forward to your continued support. Thank you once more.
Thank you, Dr. Ali. You have put the tail on this, as we say in media. You top it to start, you tail it to wrap it up, and you have nicely tailed it for us. It is only left to me now to invite you all 128 of you who are still with us, to visit the website for the Jamaica Stroke Alliance. It's jamaicastrokealliance.org. You can find the organization at Jamaica at JA Stroke Alliance on Instagram, at Jamaica Stroke Alliance on Facebook and YouTube, and you can get more information there, as well as try to find out any information you may need as we continue to spread the word about stroke prevention and stroke care in Jamaica. The message being, ladies and gentlemen, that we have to take care of ourselves and each other. Take care of ourselves and each other. There are ways to do this. You heard them today. We only pray that you will put them into action, and that you will, if this situation should occur, whether with you or someone you love, be fast. Balance, eyes, face, arms, speech, and remember, time is brain. Thank you, everybody. God bless you. Please continue to keep safe during COVID, and we wish you and your families all the best of health as we wrap it up. 11:38. Have a great day, everyone. It was my honor to be here with you this morning. Take good care.